Hello, everybody. This is Susie and Kristen from Ready, Set, Treat. And we are here to talk to you today about what else? The topic of
what's going on this week, you
2020, which is the coronavirus, otherwise known as COVID-19.
Yes.
We're going to refer to it as the coronavirus because sometimes COVID-19 is hard to say.
It's like, it's super awkward. So coronavirus it is.
Yes, coronavirus it is. And we assume by now everybody knows what the coronavirus is. If you're someone who doesn't know what it is, you probably haven't heard that we also wrote a book.
Yeah, you might be under a rock.
You might be living under a rock. So if you're living under a rock, it is a viral illness, not a bacterial illness. It cannot be fixed by antibiotics. It is a viral illness that is going around the world. It is pandemic at this point, they are saying.
Right.
And it makes most people feel mild to moderately ill, much like a bad cold. And it affects the elderly population the worst.
Yeah.
It has a very low death rate at this point. But it does have the possibility of harming people, which is why we want to keep everyone healthy.
Yeah, and we're with, we have some populations that might be more at risk, like Susie sees a lot of pregnant women or postpartum women,
or
babies.
Very tiny babies,
And then I see kids with just various medical issues or kids that even live with grandparents.
Yes.
So
we are...
Hi, Bridget.
Hi, Bridget. I know. Can we be so cheerful while talking about the
we're
coronavirus?
so excited about the coronavirus. Carrie, maybe you can deliver us some food while we're doing this.
So we wanted to talk about the coronavirus and how it is affecting us here at Therapy Square and in our private practices and how it might be affecting you guys both at work and at home and what can you do about it.
Right, and we're all at different stages too because we're mostly U.S. based. I know we have some people from other countries in our group, but most of us are U.S. based.
Yes.
We're in New Hampshire, which I believe we have like 5 cases right now.
5 cases.
I think 2 in our county.
2 in our county. I actually hung out with 4 of them recently at Dartmouth Hitchcock Hospital while my daughter got her tonsils out. That was fun.
Good times.
They did assure me that these people were enclosed in airtight rooms, so I was safe. I felt very glad to hear that.
Yes, that's always a good thing. So we're all at different stages. People in Washington are way advanced from where we're at. And I just talked to my parents in Florida this morning. It appears that things are not as, I want to say Armageddon-like. I mean, it's not Armageddon at all, but people are buying out the toilet paper, so it's not like that down there yet.
Yes.
So we're all at different stages. So the best thing that we found we can do is just to prevent it, which is what we've been reading everywhere. So we're, like with my pediatric clients, we're learning about hand washing. We have some visual schedules to learn about washing our hands.
We remind people that they should be washing their hands anyway.
Yeah, we're personally always washing our hands anyway. We've been upping our disinfecting game. So I've been Lysoling the heck out of everything between clients and beginning of day, end of day.
Luckily, we already had some hand sanitizer here at Therapy Square, which was great.
Yeah, so we already have that. So we're doing well. We're kind of just upping our protocols, standardizing like heck, and making sure we wash our hands, which is what you can do. And we put out an alert, or not an alert, but a notice on our Therapy Square page this morning and on our personal PLLC pages too about just making sure if you feel sick that you stay home, contact your therapist, and we outlined what being sick means, sneezing, coughing, fever.
Yeah, reminded everybody about our cancellation policy. We have a no-show policy, which we do try to adhere to as much as possible. But if you are ill, that does not apply.
Yeah,
we want
if you're
you to stay
sick,
home.
just stay home. We're not going to charge a fee for it.
Yes.
So, so we have that.
Exactly. What are the symptoms of the coronavirus, Kristen?
Yeah, so you could have a fever.
Yep.
You could have coughing.
Yes.
And I think overall joint aches, pains, they say it feels kind of flu-y.
A little bit,
it's
but
more
not
coffee.
Yeah, more coffee,
more
less
respiratory.
Less flu-y.
Yes. More coffee, less flu-y. So hopefully the CDC can quote us on that one in their next infographic.
CNN's going to be interviewing us soon.
But yeah, those are kind of the symptoms. And then in terms of what you do, what do you do if you feel like you have it?
I know everyone's talking about how to not get the coronavirus, but what do you do if you do get the coronavirus? So they say stay home, don't go to the hospital. The hospital is where you're going to spread it to somebody else unless you are having breathing issues. If you're having breathing issues, then go to the hospital. But if you're not having breathing issues, you should stay home. You should alternate Motrin and acetaminophen to keep your fever down. You should use a humidifier to help with your breathing, and they advise you to take cough syrup to help get that fluid out of your lungs. And that after a week or so, you should get over it the same way you should get over a cold or even influenza. And that it sounds like a decent chunk of us are probably going to get it at some point, and most of us are going to be totally fine.
Yeah, and so the thing I would do is always call your doctor too and just run your symptoms by them, because they're going to probably want to test you somehow. And I know some states have mobile clinics at this point where you like drive through and get tested. Colorado, I believe. So your doctor's going to kind of direct you on what to do in that case.
So as professionals, there are kind of two different categories that we are addressing the coronavirus in our practices. One is the cleanliness category, and the other is how do we continue to provide services while this is happening. There are some states that are already closing down schools, they're shutting down workplaces, having people work from home, that sort of thing. So why don't you talk about the cleanliness sector, because that is your thing, Ms. Christine.
Yeah, so I've just been disinfecting like crazy, disinfecting between clients and beginning and end of day, and then
which we also do,
we always do anyway, but it's been a little more hyper vigilant. And then at home too, you're disinfecting at home, trying to keep it from spreading between family members, things like that.
So we're not only washing surfaces, but doorknobs, the bathroom, every toy and object, writing utensils,
like I was Lysoling light switches and doorknobs this morning and yesterday when I was here in the afternoon and the morning. So just kind of like all the hot touch zones like that.
Yes.
To keep it clean.
Make sure things are clean. Yes. And then in terms of therapeutically, what can we do? I know in sessions, I've seen 3 people today, and guess what we talked about in all 3 sessions?
The coronavirus.
It's definitely the topic that's hijacking the all of my sessions. People, especially with anxiety, are very focused on it. So just trying to keep kind of people reined in a little bit, normalize it, and remind them of their coping skills that can ground them, while also keeping it real, and that it isn't a fake threat. It is coming to a town near you. So making sure that they have accurate information and accurate coping skills and tools and knowledge as well. It is a time to kind of put treatment goals to the side and meet them in the here and now and address these things within the session. And then kind of a cool thing that is new age, so to speak, and becoming more and more popular is this concept of telehealth. And in the event that your state goes into a state of emergency and schools are shut down and kids are staying home, and therefore parents are staying home from work and whatnot, either you might have to stay home with your families, or clients are unable to come in for their sessions, and you might consider whether or not you could continue to provide services via telehealth. And they are doing all sorts of accommodations to make that more feasible for us, aren't they, Kristen?
They are. So yesterday, Congress, I believe they passed or almost passed a bill on allowing telehealth for Medicare providers. So what that means for us in the private insurance world, usually Medicare laws, when they change, it trickles down immediately into private insurers and Medicaid. So that means that hopefully without prior authorization, you would be able to provide telehealth. You can't quote me on that, because we all know that they say a lot of things and then you do it. But we
said
predict
it now
that it will happen
at 12:23.
Yeah, I'm comfortable enough that I'm going to just go for it and see what happens. I'll roll the dice, because if it works, it works. If it doesn't, no big deal. I lost a couple hours of time. Who cares? But it's one way of providing services still. And for me with pediatrics, a lot of my clients, I need to be like game on in the same room, attending to the same thing as a kid. So realistically, telehealth might not work for some kids. It might work for others. I have others who would love to attend and talk to me, or parents who might want to consult on some behaviors. So there's a lot of different things that we can do. But I'm so fortunate because I was thinking that if I was working in, say, the school system, or which I've worked in before, or if I was working at a skilled nursing facility, which I've worked at before, I feel like I would either be put into situations I'm not comfortable in or cut off completely. Whereas in private practice, I'm driving my own ship here. I'm doing what I'm comfortable with.
You get to decide what your protocol is.
I'm in charge of my protocol. And then if I want to do telehealth and the client also wants to do it, we can do that. So it just opens up more options.
I feel like it's ethically a great option. It doesn't feel like abandonment to the client, at least in mental health. That's a really big deal, abandonment-wise. I am starting just today, actually. It felt right to start kind of addressing it with my clients, saying, like, I'll see you in 2 weeks, and between now and then, if something happens, we can discuss what our options are for telehealth. There are a lot of platforms out there to do telehealth. A lot of EMRs offer it within their software integrated. Sometimes there's a fee along with that. Sometimes they're not. A lot of telehealth platforms are discounting their fees right now to make it more accessible to people. There's a couple of free ones out there. I think one of them is called Doxy.me. Google, I'm sure you'll find something. Maybe play around with it right now, even if you don't use one.
Telehealth
so
if your family.
Yeah, right. Kristen and I can maybe
We're going to just telehealth each other real quick.
The sad thing is we probably will.
We probably will.
But so get comfortable with it. So if all of a sudden you need to make an impromptu switch, you aren't kind of fooling around with it and feeling unprofessional, you can have a certain comfort level with it. But I do think that it will become a reality in the event things shut down as much as we think that they might. But it's really great that we have that option because a lot of other career paths do not have the option to continue working in the capacity.
In skilled nursing, they probably would have either made me, gown up and glove and mask and go see the person still and get my minutes, or I wouldn't have been able to work at all. It would have been one or the other, so extreme. And here we can kind of be there without actually physically being there, which is awesome.
I have a lot of friends and family members that either work inside a hospital or work for the government or something like that are mandated to be at work. No choices.
And then if your shift, God forbid, if you're in nursing and your shift does not come to replace you, you're stuck. So this is the beauty of private practice. We don't get stuck places.
And we want to say thank you to those people that continue to put themselves out there on the front lines, our doctor friends.
Absolutely.
Whatnot. So.
And speaking of them, I've actually heard that they're going into telehealth too, even to kind of screen who needs to come in. So this is why calling the doctor is so important, because they might be able to do telehealth with you. Even primary care physicians, I'm hearing, are going toward it to screen who needs to be seen and what they need to have done. So that's kind of cool too.
Definitely find that balance of providing your clients and your patients as much information as you can about how you plan on functioning with the coronavirus out there, whether it be updating social media information as to what your sick policy is, what your plans are with telehealth, while also reining it in a little bit to not continue to promote the hysteria that's going on right now. There is a balance between keeping people informed and not stirring the pot, because that's a whole nother side of things right now.
So you just want to make sure your sources are credible. Go with facts.
Be supportive, not craze-inducing.
Exactly.
We love to hear how you guys are handling things at your private practices. I think Kristen posted a thread in the group about, share your coronavirus posts. We're happy Jenny. We're not working in a hospital right now, too.
Thank God.
But yes, and if you guys have any questions or feel like you need help with wording things or whatnot, or what might be a good credible source, we're happy to help you guys with that. Post it in the group, post it below this video. Share this video if you think people in your community would benefit from our information. And otherwise, stay healthy, guys.
And if you do a telehealth session and it's your first one, please shout yourself out in the group, because we're going to do it if we do that. I'm going to be so proud of myself.
We will.
So let us know what you end up doing, and stay healthy, wash your hands, and disinfect.
Yes.
All right? Hang in there, everyone.
Be well, everybody. Bye.
Bye.